Thanks, Matt, for being here. Could you tell us a little bit more about what your day-to-day responsibilities are like?
Yeah, absolutely. We onboarded the Amgen account late in the year of 2024. Funny enough, it's now back at Omnicom thanks to one of the big mergers in our industry. So back in its home, back where it was previously. But we did transition it in 2025. So a lot of growing pains throughout the year, figuring out what our clients want, what they're looking for, how they sort of operate in the space, and also just sort of gaining that baseline of trust. So I think 2025 was a really great learning year for us. I think tactical season was really great for us. Presented some of our new ideas in the space. And then specifically with programmatic, we're just always looking to make sure we're staying on the cutting edge of data, audience, measurement, all those sort of fun levers that we talk about out here, in the bigger conference room and get to pool on a day-to-day basis. So I think it's fun to sit in the programmatic space.
We're going to focus the conversation today on orchestration and omnichannel.
Sure.
So one of the first questions, Matt, what does true omnichannel orchestration mean beyond just multi-channel?
Yeah, I think it goes beyond activation. Someone who sits deeply in that space, I think I can definitely get stuck in a one-track mindset, looking at ways that the DSP can help merge HCP and DTC campaigns together, whether or not that's frequency, sequential messaging, buying in more channels, cross-pollinating data signals. That's all really great stuff. Need to keep advancing there. But I do think the way that we can really get omni-channel orchestration, all those sort of different buzzwords to really mean something is taking a step back at the research. What are the goals and needs of both the HCP side of the house and the DT side of the house? Oftentimes those are different brand managers, at least at Amgen they largely are. Why do creatives highlight certain aspects of treatment or delivery? Where are patients densest in our country? Where are doctors most dense in the country, depending on treatment or the brand? So I think all of those things really can help you deliver a campaign where HCP and DTC are talking to each other and it makes sense and you're not just, simply buying the next channel or, developing that next audio spot to go omni-channel. You're looking at it from the ingestion of the patient to the conversation, what those data signals are, how the HCP brand manager is interpreting that, how the DTC brand manager is interpreting that, and then tailoring your media strategies towards that.
Yeah, and what's interesting is you're actually leading into one of my next questions is how do you and your team really focus on breaking down the silos? So not only just the from HCP to DTC, but across all of the different channels.
Yeah, I mentioned it briefly. One of the things that we're really focusing on in partnership with Amgen is the patient and doctor distribution across the nation. There are certain brands, certain drugs that are really prevalent in certain pockets of the nation. I think a really good example of this is we have a drug on the portfolio right now. They are about to gain first-line approval, so their media spend is ramping up, and they're looking for new ideas. It's great. CTV would be where people would look to first. They don't have video live in the space right now. I think a lot of teams would look to CTV as sort of that next thing. Okay, you've done display, you have a heavy presence in search, you're doing social. What can we do next? And again, CTV could be the easier, the quick answer there. Interestingly enough, the patient population is in a very rural part of America. Our audience team did some of their research, found that affinity scores against streamers is actually very low. And we looked further and we found that that population in America correlates to the lightest population in cord cutting. So why did they have a low affinity score against streamers? Because they're not cord cutting very high. So honestly, CTV didn't make sense to go there.
Yeah.
We just wouldn't have a large footprint of a patient population in that area to deliver our messaging. So I think their dollars were better used elsewhere. We pivoted to more of a search intent play where we're using some of those heavy spend on search terms and making some incremental audiences for that we can activate programmatically. And we're seeing some great results from there. And I think the client was appreciative that we didn't just push them towards one thing to, go omni-channel.
Right.
And we're still doing something that is taking data from search, putting it in programmatic, And I think that's what our clients want to see. I think that's the goal of what we're all trying to do, but, you know, not just blindly putting forward, you know, CTV or audio when it might not make sense. In this case, it didn't.
Yeah, I mean, it's really smart to be taking data and insights in a true fashion and actually using that to inform the strategy. One of the next questions, kind of tapping back to what you were saying earlier, I'm curious how you and the team at Amgen particularly are utilizing real-time data to help. Um, like, how does that play into your orchestration strategy?
Yeah, it's huge. And data's on both sides. It's not just measurement, it's also the input we get too. Amgen does a really good job of funneling us updated NPI lists on a very consistent basis. That's a direct connection set up between Amgen and actually DeepIntent. So you guys are getting NPI lists updated very regularly from field rep data, and then we're able to use those in the DeepIntent DSP. They're automatically applied to our campaign, so we're not having to constantly, you know, change out the targeting or swap out the list, or, you know, it's all happening in real time for us as these field reps go and meet doctors. They're writing down notes in, you know, in their, you know, whatever systems they have. That's getting passed over through their data connections into DeepIntent, and then we can use it. Not only is the NPI list getting updated, but it's also getting resegmented based upon the HCP behavior. So, you know, in the space, we hear terms like dabbler or adopter or things like that. You know, what do those mean? Doctors have, you know, different prescribing habits, and our media strategies change based upon the type of doctor they are. Are they a high prescriber of a competitor? Or are they a high prescriber of our brand? We would do different messaging for that. So if there's a doctor who all of a sudden has transitioned from being a non-prescriber to a prescriber, we want to make sure that's picked up as quickly as possible. So that's something that Amgen is doing well with you guys, and then we're really reaping the benefits of that. Well, Amgen is reaping the benefits, but we get to use the data and play around with it. Then on the measurement side, I think it's really great. Our DSP partners have really taken the time to set up systems where we can look at data quicker sometimes than we're getting from third party. So I think as long as that data is reasonably aligned, our traders can activate on that. And yeah, it just makes the feedback loop that much quicker.